So if you have already planned for a umbilical hernia repair surgery or you have undergone it, this is helpful for your recovery. So here are some recovery tips or recovery guide post a hernia surgery. It could be an umbilical, it could be an inguinal, ventral incision, any one of them. Okay. So these are general advice to help you recover properly from a hernia surgery. Normally, after your hernia surgery, let's say if it's undergone a laparoscopic method, 2-3 days later you are discharged, you are at home. Now, what and all can you do? With respect to food, in case there is no intestinal complication, obviously a doctor will tell you what sort of a complication you had, whether it's a simple thing. If in case there is no intestinal complication, you're getting back to regular diet in a couple of days. Initially something a little soothing. There's another video of mine of what you need to have after surgery. You can take a look at that. The link is placed below. Along with that, you go a little slow on the diet and you get back to normal diet, let's say within a week's time. Now, with respect to what sort of activity can you do? Once you have had an umbilical hernia surgery, these are activities that are generally considered safe. Walking is considered safe based on your general condition. Sometimes surgery is a very stressful event. It pushes you up on the stress level and then gets you down. So you may feel a little fatigued and all that. So let's say after a week's time, walking is fine. You can increase it slowly. Let's say you can go for, let's say, half a kilometer initially and then slowly progress it to 1 and 2 and get back to your regular walking pattern. Now, climbing stairs is definitely not a problem. If you're reasonably healthy, again, climbing stairs is not a problem even after 2 days of surgery. Yes, it may tire you out and may cause a mild amount of discomfort, but it's still permitted. A complete no-no after surgery is lifting weights. See, you have had, if you notice, whenever you lift a weight, let's say if it's 1 or 2 kgs should not be a problem. Anything more than 5 kgs or let's say 4 kgs, when you lift, there is some amount of core tightening that happens. It is an involuntary aspect of how the body is designed. So core tightening happens. This does affect your hernia repair. So it's a complete no-no of lifting weights. No lifting buckets with water, no pushing cylinders. You have kids at home, no lifting the kids. You have a toddler at home and you have undergone a surgery, you can let the toddler climb up onto you, but no lifting the toddler. Because any lifting activity will cause pressure on your core and this will worsen the healing. One of the another important factors is alcohol and smoking. Both of them deter healing very aggressively. So let's say a smoker will take a much longer time to recover compared to a non-smoker, and the healing is poorer in a smoker compared to a non-smoker. So this will definitely affect the hernia on a long-term basis. People ask, can I travel? Traveling by a four-wheeler or auto, let's say even bus, train, car is fine, even 2-3 days after surgery. No two-wheelers at least for about 2 to 4 weeks after surgery. So two-wheelers, because of the way you sit, the pressure that falls, we do not recommend. If you have had an inguinal hernia, that is in your groin, definitely don't recommend a two-wheeler for at least a month. And how about, let us say, many people again come back to asking, I have a desk job, can I get back to sitting? Sitting generally is not a problem, you can go ahead, but yeah, it will be uncomfortable initially, but with time it gets much better. After how many weeks is exercise permitted? Normally, see, the external wounds heal within about 10 to 12 days, but the internal healing properly takes close to 3 to 9 months. Normally, that 3-month period is a good enough period where 90% of the wound has healed internally. So, after 3 months, you can start getting back to some sort of a core exercise building activity. Let's say crunches or even lying down flat and lifting both your legs and let's say even lifting your neck to strengthen your para-umbilical muscles is always useful. So, after the 3-month period, you can get back to your gymming activities, weightlifting, all those. Again, gradual. When you do the first time, you will have some discomfort. With time, it gets better. Please meet your surgeon who is operated on you to know regarding the timelines. But on a general aspect, 3 months is a good enough period where you get back to all your regular activities. And most importantly, avoid putting on weight after a hernia surgery. It's one of the mesh doesn't grow with your body. Remember that. So avoid putting on weight, and be reasonably active. This generally helps on a long term basis. Hopefully, this was useful to you. Thank you.